And if you haven't put your GOC number when you registered, please can you email the Academy manager, the EO manager, or you can put it on the chat here so that when we create your certificate, we can add your GOC number on. Okay, the certificates will probably come out in a week's time. We will then create once we've checked who has remained till the end. And you probably also heard the message that this session is being recorded. This is a session, Academia for European Academy for Optometry and Optics, and our members get access to this recording for their learning as well. So it doesn't matter whether you're getting CPD point or not, there's still a lot of learning to be done. So it is my great pleasure to join Dr. Ving Chan to present this session, which is about gender and eye care. So Ving will take you through some slides and then we will have a discussion as we're going along. As I said, if you have any comments that you want to make, please unmute yourself and join us, or please put something in the chat because I'll be monitoring the chat. Thank you. I'm going to hand you over to Ving.
Thank you very much. Thank you. I think I have met quite a few of you during the European Academy last year, 2023, yes, and it's a pleasure to see you all again. Well, today the session is on gender and eye care. Now, I must admit that I am not an expert in gender and eye care, but I have did quite a bit of work in this area because I don't think one can be an expert in this area. You just continue learning along the way because it's a very fluid topic. So I hope you can join me in the discussion so that I can learn from you as well. What I'm going to do now is that I'm going to share my screen with you, and some PowerPoints will be shared. So if you can see my screen, just let me know, okay? Great. Can you see my PowerPoint? Yes? Okay.
Yes, we can.
Go to the beginning. All right. Now, today is on gender and eye care. So what I'm going to do is that before we start the session, I'm going to give you some questions, and you will need to write down your answers on a piece of paper. And then after I have done the presentations and then we have discussed, we will re-look at these questions again, and you will know whether you have got the answers, the questions correct. And if you have any thoughts after that, do let us know. Either put it in the chat box, and if I keep on talking, ignoring you, just unmute yourself and shout at me. Then I will stop and listen to what you have to say and discuss. So, well, now we will start with the first question around gender and eye care. And let me just minimize my. So question number one is, what is gender equity in eye care? Now you can choose more than one answer for this question. So do you think gender equity is about equal treatment of all people, regardless of their gender identity or expression in all aspects of eye care? Priority treatment of women and girls in order to address the challenges they face in accessing eye care? Treatment of eye conditions that are specific to women and girls, or all of the above? Okay, you can choose more than one answer here. Okay, now I'm going to go to the second question now. Question number two, what is the major challenge that women and girls face in accessing eye care? And again, you can choose more than one answer. Financial barriers, lack of awareness, cultural barriers, or gender stereotypes that discourage women from pursuing careers in eye care? Remember, you can choose more than one answer, okay? Great. The next question. What is a gender-specific eye conditions that women are at increased risk of developing after menopause? So we have preeclampsia and eclampsia, glaucoma, dry eye syndrome, and AMD, age-related macular degeneration. And you can again choose more than one answer for this one. Okay. Next question. Which of the following can sustainably promote gender equity in eye care? You can choose more than one answer. Increase the number of women in the eye care workforce. Bringing eye care services at the doorstep to women and girls. Educate women and girls about their eye health rights and how to access eye care services. Or D, all of the above. Okay. Great. So these four questions, we are going to look at them again later after we have finished our presentation and discussion, and then you can reassess yourself and see how well you did. Now, in today's session, what we are going to do is that, or what I'm going to do is that in the presentation itself, I will let you have a look at the evidence of gender inequity in eye care. And then we will try to learn from you and to understand from your point of view whether there are any differences to access to healthcare between genders, male and females population. And then we're going to discuss the solution that eye care professional can take forward to reduce barriers in making access to eye care equitable, as well as you can share any success stories either in your practice, in your university, in your hospital. That's what we want to know, and that's the aim of this whole session. It should be a discussion rather than me doing all the talking. So let's start from the very beginning. What exactly is gender equity in eye care? The first thing that comes to people's mind when we talk about gender equity or gender inequity, the first thing that comes to mind is women and girls. But if you really look at the concept, the principle itself, gender equity is not only about women and girls. It is about everyone. Doesn't matter you are a man or a woman, a girl or a boy, everyone should be able to get the eye care that they need when they need it without facing any discrimination or barriers based on their gender. So it could be men, women, boys, or girls. So I'll give you some examples here. And you will find that most of these examples focus on women and girls, most of them, because that is the challenge we face today. So
I think we've lost Ving for a bit. Oh, he's back. Excellent.
sorry.
We lost you for a bit, but you're back.
Okay. Where have you lost me?
I think at the start of your last sentence.
Okay. So what I was saying is that gender inequity, it not only revolves around women and girls, but for men, boys as well. But the reason we are focusing so much on women and girls these days is because that's the challenge we see today. So this is the first example I gave earlier, is that if a woman is pregnant or is breastfeeding, they should be able to get the eye examination that they get. you might not, or you might have seen in certain countries where it is actually forbidden for women who are pregnant or breastfeeding to attend an eye examination. Another example will be a transgender person should be able to get eye care without being misgendered or discriminated against. And in a lot of more Western countries or high income countries, you see that this is, people are a little bit more aware of this situation, even for eye care practitioners. But in other countries, it is still a very big stigma for a transgender person to even get not only eye care, but health care in general. A woman living in poverty should be able to get affordable eye care. A girl living in rural areas should have access to the same quality of eye care as a boy living in urban areas. And we see that a lot in sub-Saharan Africa, where I used to live and work. If you have a girl or a daughter or a son having this eye problem in the same household, the girl will be the one who's, the boy will be the one who's giving the priority to access eye care. The girl will usually stay at home and continue to have that vision impairment that they are having. So there is a gender inequity there. Now, I'll give you some statistics here, which I find very interesting around gender inequity in eye care. So, of the 1.1 billion people with vision impairment, more than half of them are women, and most of them live in low and middle income countries. So this is a very great inequity there. For women, they are also has higher risk of vision impairment. Some conditions are age-related. Some conditions are also gender or sex-related. So for example, age-related macular degeneration, trachoma, dry eye, cataract, and glaucoma. And this is something to do with the hormones in menopausal women. Women also has less access to care. Women usually, if they are not the income or they do not generate income in their household, usually they would have to depend on their husbands or another male member of the family to provide them the money to access these services. And most of the time, they don't get that support. And you can see that more men than women have access to good quality in cataract surgery and also refractive error services. Women also have cultural barriers where you can see that if a girl needs glasses, in a lot of countries, the parents will tell the girls, don't go for eye exam. If you need glasses, don't wear glasses, because if you wear glasses, you're not going to get married because people know you have an eye problem. And it might be surprised, it does still happen today. There are also lack of availability of gender-specific eye care professionals in some predominantly Muslim countries. A female patient can only be checked by a female opticians or optometrists. So that is why they have less access to eye care. And I always believe that if we need to solve the problem, we need to also tackle at the higher level. And at this stage, we still have great underrepresentation of female leaders among decision makers. And it is quite a difficult thing to push, or an agenda to push in terms of gender equity if you do not have women among the decision makers to actually advocate for women themselves. And there are also additional barriers for ethnic minorities. So ethnic minority women hold the fewest leadership positions, and this leads to less probability of actions that address the actual needs of the population. That's exactly the same point that I'm making earlier. So now, this is a question to the floor now. I pass the chance to you to speak now. So, have you observed gender inequity in your own settings? So, reflect on three things. Reflect on your patients. Do you see that there is a disease patterns among the patients that you see? Okay. Also reflect on the care provision. Have you ever noticed that there is inequity when it comes to providing care to either men or women in your setting? And for those of you who are working at a higher level at a university, think about the number of women leadership you see in the places that you work in. And I really would like to hear your stories. So what I'm going to do now is that I'll stop sharing my screen for a second because I would like to see your faces. Okay.
Please unmute, put your hand up, and then we will Rose.
Hi. Hello. Sorry, I've just got my coat on. I've just managed to join. Hello, everybody. I think I'm pretty fortunate in the aspect that I've spent most of my professional career in Fleet Street, central London. And even though there's a lot of male judges and stuff, there's quite a lot of women there as well. And they're quite powerful, to be honest. So I haven't really witnessed what you're talking about, except for, and it's taken me back to just after my pre-reg year when I worked in Lea Bridge Road. And that was quite a different area, definitely quite impoverished at the time. And that was back in 1991. So you definitely saw a difference there in women not particularly coming forward with eye problems. And again, I did see quite a bit of, especially in certain populations, in certain ethnic populations there, the girls wouldn't particularly want to wear glasses. So that was quite interesting. And being Asian and brown, because I was wearing glasses, it kind of opened up a conversation a bit like, you're wearing glasses, is that okay? And I was like, yeah, it really is, and I can see really well. And on top of that, they were kind of asking me questions like how did you get, how did you become an optician? Like, what happened? And so that was quite interesting. And it's only now that you're talking about it that I'm reflecting back and thinking about that. Also traveled to Africa quite a bit, very different environment, culturally very different. Standards of the environment are quite different as well. And you have pockets of communities that do really well and pockets of communities that don't, but that is very gender-based too. I don't know, it wasn't very concise, but it's just observational more than anything else.
Thank you for that. Any other comments?
Well, just from a different perspective, I'm South African, but I'm GOC registered. My husband's Irish, so we live in South Africa, but we do commute quite a bit to Ireland as well. And so I've got a private practice in Johannesburg, which is a big city in South Africa, and we do see a variety of, well, inequity is a big issue, but every second week on a Wednesday I work in government, but I work in quite a impoverished area and in a government hospital that has really got access to all resources. And one of the biggest issues we deal with, because I'm doing my ocular therapeutics, is a lot of gender-based violence. So a lot of our the situations and things that we are treating are people who've been, women that have been hit and abused by a spouse or their male partner. So we see a lot of retinal detachments or perforations and orbital disruptions and stuff like that. Yeah, and then we just see an inequity in terms of the haves and the have-nots. So those who've got money and those who don't, because private healthcare in South Africa is phenomenal and really good, and we have people from all over the world who travel here. But if you don't have the money, you don't have access to that. So there's total inequity between those, the poor and the rich, and there's a huge gap, and it's very apparent in everyday life.
Thank you for that, Catherine Ann. John, did you want to come in?
Yes, I mean, I'm going to try and unmute myself.
You haven't
Can you
muted.
hear me?
Wait for. While waiting for John, anyone else?
While waiting for others, let me just make a comment. I think what was it Rose mentioned earlier was very interesting, and you say that that was what you saw in 1991, where you have experience with maybe a pocket of people who actually face that sort of stigma. And as I say, it's really interesting that in today's, in many countries, especially countries that are working in sub-Saharan Africa, we still see that. And we would have thought that after 20, 30 years, things might have changed. And things are changing very slowly. That's a very sad thing that we see. And to Catherine's point, another thing that I saw, I used to work in South Africa as well. One of the places that I work in is Soweto and also Alexandria. And we have all these community eye centers, and the gender-based violence is a big issue because you see women and girls coming in with retinal detachment, injuries, cataracts because of injuries. That was a big issue that we face in those areas. So I totally understood what Catherine was saying earlier.
We have John back, so hopefully he can unmute. You still muted?
Oh, is that working?
Yes.
Oh, good. My experience is only quite limited because I have only lived in the UK. All I can say is that with working in Plumstead, and there's a huge population of Gurkhas, and obviously there you notice the wife can't necessarily speak English and can't even write. So I mean that's only my slant on that really. But obviously it's the same scenario that the man he's taught everything and the woman is, it's a different role. So
So yeah, so again, as Ving was saying, that the difference still exists in different parts of the world, even in the modern day now. I mean, we're all just talking about 1991 to now. We are still seeing pockets of all of this happening. I'm going to ask Ving if it's okay to share his slide to go to the next question, and if Jennifer will come back to you after we've moved on a bit because I'm looking at the time.
Sure, I'll do that. I'll do that. 1 second. Okay, can you see my presentation again?
Yes.
Good. So the second question is actually a follow-up from question number 1. So we know that there are these challenges out there facing, many women and girls that we were talking about. So what can we do as eye care professionals, no matter where you work or your role, whether you are an optician, optometrist, working at high street, working at hospital, at the university, what can we do to reduce gender inequity in eye care? Okay, I'm going to stop sharing my screen again and I'll open the floor for discussion.
I'll give first go to Jennifer because
Jennifer, yes.
we can't hear you. You have unmuted, but we can't hear you. Jennifer, we can see that you are talking, but we can't hear you. Do you think you could put what you want to say in the chat?
for those who work in an academic institution, is there anything that you have seen when it comes to gender, and what were the steps that you have taken in order to promote the profession to more women?
I have to put my hand up. Yes, I work in an academic setting and I have traveled across different parts of the world to support education and training of opticians and optometrists as well. There is definitely, as you rightly said, the high income country, access to university is generally acceptable for all genders. But in some of the countries, healthcare roles are seen as more female, because they're meant to be more empathetic, and men are meant to be in the more higher earning business kind of roles. So in some countries you will get that, but then you get the flip side, as you rightly said. If you're a woman clinician, then your family may not be keen for you to see male patients. So you may get the flip side, that in a very female-oriented setting, men don't feel comfortable or don't feel that they can come in and have their eyes tested by another woman who's going to get this close to them while doing the eye test. UK universities, and I'm sure a lot of the American and maybe Canadian universities will do this, we have to check our performance of the different genders and different ethnicities in terms of their outcomes. So who gets the higher marks of the degrees? Is it, you know, female and white, or is it female, Black, or Asian male? So there are always these kinds of metrics that we have to look at, and then we have to redesign our courses to make sure it is equitable for all. But sometimes it doesn't always work. So there are still, I guess, gaps that we can fill.
Well, from my point of view, we have to see what the law says in each country. And the governments must change the law, and after we follow the rest, but need some years, maybe 5 or 10 years.
And do you think having a woman advocate or woman leader leading this this sort of policy change does have an impact, or it doesn't matter whether it's a man or a woman fighting for this cause?
Well, I am not familiar since I am a European one, but I know that in Egypt, in Africa, the situation is very strange.
Thank you, Kyriakos. Rose, did you want to come in? You're on mute, Rose. Rose, you're still on mute.
Can you hear me now?
Yeah, we can hear you.
I can't see you guys, but I can hear you. It's really interesting listening to these discussions, because I think it goes way deeper than what we can do, because it goes to self-worth, doesn't it? And what a particular environment tells you you're worth as well. Does that make sense? So it's quite interesting to, I mean, I remember when I was really young, I was born here in the UK, and I was one of the only non-white kids at school, right? And I used to go back to East Africa quite a bit. And one of my first conscious thoughts was the fact that I couldn't believe we had a queen, and that a guy would walk behind his wife, because I'd never really seen that. And then we had a female prime minister, and that again was a complete like wow moment for me. And it kind of changed the way in which I saw things. but that's me as an individual. I remember talking to one of my cousins about this when I was back in Africa, and she went, well, that's just ridiculous. That should never be happening. So I'm not sure what I'm trying to say, but I think what I am trying to say is it comes so much from the environment that you're actually born in and how you're raised. And we all know that our most formative years are the first 8 years of your life. So your self-value and your self-worth comes into this, and that's set well before we even get to a lot of girls, boys, whatever it happens to be. So I'm still not quite sure what I'm trying to say. I guess what it is I'm listening to different people's comments. I read your comments as well. Sorry, I haven't got the screen up in front of me, so I can't see you guys. But it is just interesting what the environment, what education, and I think what money affords as well, if that makes sense. Because going back to Fleet Street, which is Judge Land, everybody there felt entitled, whether they were male or female, but I'm meeting them at such a formative part of their lives, and what that's done for them. I'm still not quite sure what I'm trying to say, but there we go. Anyway, I'll stop for.
I think that is a very important point that you mentioned, and it's quite similar or related to what Jennifer has put in the chat box. In their different places where you have an environment which is very supportive.
We've lost Ving.
So can you hear me?
We can hear you, we can't see you, but that's okay. Carry on.
Supportive. And as you can see here in the Highlands of Scotland, it's unheard of that you can tell a woman you can't do something. It's unheard of. And I think what we are trying to do today is that we want to invest a little bit more in children, especially in girls, in areas that we have not able to make a change that we want to see. For example, in very rural areas in Africa, in places that I work in Zanzibar, which is predominantly Muslim, very patriarchal. We want to start young so that we can actually have the girls to have that self-efficacy in them, to actually know they can do a lot of things. And eye care is just a small part of it, because if the environment is supportive, we will be able to make sure that the girls, the women, able to have a say and decide on their own health and well-being as well. That's why I think both Rose and Jennifer brought up a very, very good point there.
I mean, if we start sharing so that we can go back and look at what we thought, and while you're doing that, I'll make a comment on what John had also mentioned. Ving is right. If we can help the younger generation understand the importance of eye care, and as you mentioned that some of the women in the Gurkhas weren't even educated, but vision is getting good vision is a big part of your learning. So if we can make sure they have access to good eye care, they can see well, they might go further in their education and then become the role models, that something that Rose and Jennifer have mentioned, for other younger generations coming through to say, you can achieve this. It shouldn't stop you from achieving what you want. You need to be brave and go out and get what you want to get. But if they can't see well enough, if they can't get access to good education because they can't see, then that is more difficult for them to be able to go out there and get into the roles that we need them to advocate, change, be a leader for all the future generations to come.
Exactly. I'm going to share my screen again. But before I do that, there is one point that I want to raise from, I think his name is Kyriakos, who spoke earlier. There are countries where we have very strong women advocate. I'm taking Sub-Saharan Africa as an example because that's where I live and where I work. In Nigeria, we have very strong women leaders in eye care, and they are making great progress in that country. But you also can see there are countries where we do not have that many women leaders, and that's when I think men has to be part of the conversation, because I believe that if we want to fight for gender equity, you can't have only one gender who is doing the fighting. We have to have everyone in one voice to do that. And that's why I think it's important to also make our us male counterparts to understand how important it is and how
Myslel,
bad
že
it
to
is
bude
if we don't
víc,
solve the problem.
jakože
Sorry? Is something happening?
No, carry on,
Sure.
carry on. There was
Okay.
someone joined who was not muted.
Sure. So that's the point that I want to make, that we, men and women, should be educated enough to fight for gender equity. Now I'm going to share my screen again. Just give me 1 second. Where was I? Here. Thank you so much for all the discussion points. I am really appreciative of that. Now, these are some of the recommendations given on the WHO website and also the IAPB website, the International Agency for the Prevention of Blindness. If you have not accessed that website, please go on to the IAPB website for all of these information. Number one is make eye care services more affordable and accessible, especially in places which is a little bit poorer or socially deprived. And this can be done by providing subsidies for eye care services in the public sector that we are looking at, especially in sub-Saharan Africa, increasing the number of eye care providers and facilities, and making it easier for people to travel to access eye care. So I can just share with you one experience that I had when I was working in Eritrea, which is Northeast Africa, where people will have to bring their child 1 day earlier to the hospital just to come and see me for eye examination. And then they have to stay overnight and then they go home. So 3 days they have to spend on the road just because they want to have just a simple subjective refraction. And just imagine the lost wage that the parents will have to bear because they are not working for those 3 days. Educate women and girls about eye health and the importance of eye care. This can be done through school health programs, community outreach programs, and public awareness campaigns. Now, this sounds really simple and it makes so much sense, but looking at the economic situations that we face throughout the world, we are not in a very good shape. And there are a lot of budget cuts at the school or education platform. And one of the things in the budget that's being cut immediately is school health. So I think this is something that I have been very vocal about when I'm doing my school eye health program, that the budget for school health should not be taken off the budget. Challenge cultural barriers that prevent women and girls from accessing care. This can be done through social norms campaigns and other initiatives to promote gender equality. And we've spoken quite a bit earlier, is to create that supportive environment since young. Train eye care providers on gender equity issues. This can help eye care providers to provide more culturally sensitive and equitable care to all patients. And that's what we are trying to do here, to discuss and to make sure that we learn a little bit more through these sessions. Now, I am going to share the questions that I have posted earlier again, and you can now answer these questions again and see whether you got the answers, the correct answers. Okay, now we started with question 1. What is gender equity in eye care? And you can choose more than one answer. Right. So
And can I ask, did people choose multiple answers or did they just go for one?
you can choose more than one answer.
Yeah, but from when we asked, did you feel there were more answers here then? No.
Rupal, does anyone have
No
any
one to share.
any- the chat box? Can't see the chat box now. No?
No.
Great. The answer is equal treatment of all people, regardless of their gender identity or expression, in all aspects of eye care. As I said earlier, it's not only about women and girls. It is for everyone. Doesn't matter you are a man, woman, boy, or girl, you should have equal treatment. The second question, what is a major challenge that women and girls face in accessing eye care? And you can choose more than one answer.
Is anyone willing to put their answers that they put on a piece of paper in the chat?
Yes?
Yep. Laura went for all. Tata went for all. Everyone went for all of them.
You all are so clever. The answer is all of them. Hey, shall we go to the next one? Third question, what is a gender-specific eye condition that women are at increased risk of developing after menopause? And you can choose more than one as well for this question. Anyone wants to share your answer?
A lot of people went for C. Some went for all again. B, C, and D. C, B, C, and D. C, B, and C. I think no one went for A. Which is good.
Which is good because the answer is B, C, and D. Okay, and you can look at the literature. And many of these, as I said, it's because of the reduction in estrogen. Estrogen has a protective mechanism towards glaucoma, dry eye syndrome, and also AMD. Especially, I think a lot of you has gone for C, dry eye syndrome. That's absolutely correct because the tear production reduced when a woman reached menopause. Hey, very good. Question number 4, which of the following can sustainably, okay, the key word here is sustainably, promote gender equity in eye care? Anyone wants to try?
We've got a few Ds. We've got a C. We've got A and C. We've got a D. D. A and
D.
C. A few Ds again. More Ds. Lots of Ds.
Okay. Now, as I said, the key word is sustainably. Okay. And let's look at the answer. Oops. Sorry. The answer is A and C. And we want to make sure that we will improve people's behavior. And this behavior is positive health-seeking behavior. Having services brought at the doorstep can solve the problem very superficially. Okay, there are certain cases that we have to, but in the long run, for sustainable gender equity, we need to increase the number of women in eye care workforce because, as you know, in some places we really do not have enough women, and educate women and girls about their eye health rights and how to access eye care services. This is about self-efficacy. Great. I think the presentation, the discussion has come to an end. But what I want to do now is that I want to challenge you. Okay, I want to challenge you to look beyond gender equity. We look beyond equity. We look at empowerment, women's empowerment. And I'm going to just use 5 to 10 minutes to talk about something that I have been working on, which is something I'm very passionate about. So in 2010, I started working in Zanzibar. And at that stage, we found that among the general population, about 90% of the people over the age of 40 has presbyopia. But there are only about 17% of them corrected. So a very small number of them are being corrected. 10 years down the line, in 2021, I went back to Zanzibar, and I found that, or I heard from the local stakeholders that uncorrected presbyopia is still a problem, despite in the 10 years, there are plenty of NGOs working in that place, and a lot of initiatives have been put into place, but yet there is still a problem. Now, I was very skeptical. With all this investment put into a small island in East Africa, why are we still having the same problem? I was very skeptical. So I went back and we look at the situation, and we look at this group of very unique population. They are craftswomen or women entrepreneurs. Now, just to give you a little bit of background of Zanzibar. Now, in Zanzibar, there are a lot of women who generate income through working in at the women's cooperatives. So they do artwork, and all these things needs very precise near vision. And about 23% of these women are the main providers for their household. And compared to men who support 4 to 5 unemployed persons in a household, these women support an average 9 unemployed persons. And the reason is because many of them, all these older women, they were widows. Not only they have to take care of their family or her family, she also had to take care of the husband's family, and also maybe some other male family members' family as well. Family members' family as well. So they are taking care of 9 unemployed persons. So there is there at the foundation level, there is gender inequity that exists. So then we went into the cooperatives and look at those who are 35 years old and older. We chose 35 years old instead of 40 years old. It's because in sub-Saharan Africa, hyperopia is a big issue rather than short-sightedness. So their near vision deteriorates a little bit faster. And we found that about 30% of them has distance vision impairment, and 65% of them is because of uncorrected refractive error. So easy to solve, but none of them were wearing glasses. About 87% of them has presbyopia, and only one of them was corrected adequately. So it is not a very good situation. So what we did was we provided them with glasses, near reading glasses, and we followed them up for 6 months. And we found that, of course, we did a survey before we give them the glasses, and 6 months later, we repeated the survey, and we looked at their subjective well-being. Subjective well-being is a measure of satisfaction in life, and that is very important when it comes to empowerment. And we found that 6 months later, their subjective well-being improved by 4.8 points out of 10. Work productivity increased by almost 0.85 or 85%. And we repeated the survey on empowerment, you found that they have greater economic, social, psychological, and political empowerment, and it's about 78% of them. And the quality of life scores also increased by 8.28 points. So we can see that just by giving them a simple pair of reading glasses or near glasses, we have a big impact in people's life. I'm going to stop sharing my screen now, and I'm going to show you a short video about the project. And you can always write to me if you want to know more about this project. Where is this? Is this one? Okay. Can you see my screen?
Yes.
Yes. I'm going to play the video, a very short video. Sorry. Start again. So that's it from my side. Thank you so much for your attention. And I'm going to pass this time back to Rupal for some closing remarks. Thank you.
And we can carry on the discussion. Alexander. Got your hand up?
Just a minute. Can you hear me now? Yes.
Hear you, yes.
Hello. Thank you very much for the presentation, for the webinar. I needed to ask a few things. Like, so one of them is, sorry, I have not managed now how to do the video here, so you can see me, but let's see, start video, maybe not. In any case, oh, okay, yes, here. So, yes, if you like that, this better. So, one of the most important things I wanted to say to women, or in general to our profession, to say that I'm so sorry, nobody mentioned to me before I gave birth, because I had high myopia. So nobody told me to do this when I was giving birth for 6 hours. So my eyes really, my astigmatism went high. And also, please bear with me because I'm not speaking well, because I had a small stroke 2 months ago. So I'm speaking a bit slow. I resent a little bit that nobody told me. And why nobody told me? No women, no men, friends of mine, that when I was giving birth, I should, keep my eyes, not bulge my eyes. And this happened to me. So after this, I had to have laser because I couldn't even find no proper prescription, even though I did stereoscopic exercises then. So that's one thing, one important thing for people, for men, for women who give birth. And then let's see. So also I read on that at first women would see at close focus, and that was one more reason. And men would see in the distance when they were hunters and things like that. So that's why there was a difference about the eyes. So now I wanted to ask whether you think that for cataracts, do you think that men have more or women less often, or earlier people for cataracts? Do women, or I don't know who will answer this, I'm just asking in the panel now. So also I see it's not decent to get people incorrect prescriptions and from or making wrong optical glasses. Okay. So these are things that need to be not done. Sorry, I'm speaking again. Remind about the stroke. I'm speaking when I'm tired. I speak playing and not. Okay. So about the one question was about the giving birth, educating women about this, and also of course gynecologists, okay, or whoever, and all the people who give birth. What are they called? The midwives. And also number two, do you think that more cataracts get more? I don't know. I haven't researched on this statistic. Men get more cataracts or less, or women less. And then there was one of my colleagues who is there, because he knows about keratoconus very well on his island. Okay. Do you think that I don't know, do women get more keratoconus than women than men? And that's it, my question.
We'll come to keratoconus later for the keratoconus, but Wing might want to answer the cataract question.
The cataract situation that we see in many countries is that there are more women who has cataract. And the reason is because women live longer than men. So we have a lot of cases for cataract. And the other thing that is that makes it even worse is that women do not have the same access to cataract surgery compared to men in many places. And as you know, when you wait and the cataract becomes more matured, hyper matured, there are a lot of other things that comes with it, complication that comes with it. For example, glaucoma comes with it. And then also the success rate on operating on hyper matured cataract is far lower. So I think all these things kind of make women in a more vulnerable position when it comes to cataract. That's all I can say about cataract. Keratoconus, I'm not an expert in it. Maybe someone on the floor, is more specialized in this area, or as Rupal says, there is a dedicated session on keratoconus.
Kyriakos, do you want to answer for a few minutes?
So my comments are that women and girls have a smaller axial length than boys or men's. About keratoconus have to do with allergies, dust, and sun. These are my comments.
Thank you. Alexander, we're just about to finish, but I'll just add Asian males, so this is Southeast Asian males, so brown-skinned, are more allergy prone, and they're more likely to have keratoconus in that ethnicity band. But then when you look at worldwide, as Kyriakos has said, it depends on whether you are Arab and you have allergies, those kind of profiles come into play. So you will get geographical, so pockets, different countries will have different ratios. But yes, that could be an area that we look into for the next 2025 Academy Hour as well. Before we finish, just remind you on the 8th of February, we have our next Academy Hour, and it is for those who are educators or those who are starting to supervise or train the next generation, a workshop on active learning. So 8th of February is the next Academy Hour, and it's on active learning. Those who want their CPD points, if you've been on the webinar for 50 minutes or more, next week, late next week, you will get your certificate. And everyone who's attended, you can ask for a certificate of attendance so you can self-certify and get your points. Can I just say thank you very much to Ving for taking the time to share with us his experience, to raise some awareness as well. And thank you very much to all of you for joining us and for participating and being open to discussion and being open to say, we don't have the answers, but we can work together to try and bring a little bit more equity as we move forward. Okay. And thank you for Christina for organizing our webinar and the management of the Zoom meeting as well. Thank you very much.
Thank you.